so we can get started. Okay, I think we're ready. Dr. Dorsett and Allie, I will hand it over to y'all.
Wonderful. Thank you all for being here today for our webinar on mentorship in action. Like Shelby shared with us, this was a webinar that we had the opportunity to present at the recent Texas SMVP conference, and excited to bring it to you all virtually today. So I wanted to kind of start off with being really honest in that most of us who supervise interns were never really trained on how to mentor. We are good at our jobs and we figure out how to get things done, and we engage with our students in the best way we know how. And sometimes we just end up with an intern and we have to figure out how do we make this an experience that is both helpful to us as employers, but also a growth opportunity for our students who choose to work with us. I had the wonderful privilege of having a fantastic internship experience when I was an undergraduate, and it changed the trajectory of my career. And sometimes that can be a really, really great opportunity to launch a student into a professional career in public health. But other times the experience is more of a answer tons of email and help us at this event. So hopefully by the end of today's presentation, we'll talk about the difference, how you can design an internship that will actually help shape our future public health workforce and make a mutually beneficial experience for both of you. So my name is Dr. Lauren Dorsett. I'm an assistant director in student life and have overseen quite a number of internships through our unit's prevention and education work. And then I'll let our other presenter introduce herself.
Yes, howdy. My name is Allie Norris. I am one of the lucky people who has had the opportunity to do an internship with Lauren. I completed my internship in the last semester of my undergrad degree about 2 years ago, and now I'm in my Master of Public Health, the last semester of my Master of Public Health degree at Texas A&M.
All right, so I have been increasingly concerned as I have been monitoring sort of the public health landscape and the higher ed landscape. We have a lot of really talented students and they're graduating and going out into the workforce. They have strong coursework, they know theory, they really care about this work, but many of them don't have a meaningful applied experience. And at the same time, supervisors and those who are working in these fields are often stretched really, really thin. So mentorship is often something that's just added to somebody's plate and it's not designed within their role. So we've noticed that this gap that students need experience, practical applied experience in public health, that organizations also need workforce ready professionals. And sometimes internships are not really structured to be that option. So what we think could help is that if we design internships that are intentional, we can both fill that gap and provide an opportunity for workforce ready experiential learning.
So this is kind of a roadmap for the webinar today. So we're going to talk about why internships matter. We'll then move into what makes them effective, and how to really get something out of it. Then we'll go through mentorship and goal setting, and also how that works in practice so that students leave ready for the workforce. And then we'll end with some lessons learned and some practical tools that you can take from this.
So let's start by thinking about two models of internship experiences. In the first model, we have our task managers. Your interns that might answer phones, they might answer emails, they might help with events, they do what you tell them to do, they might file papers, do administrative duties, they might fold your t-shirts, right? But then we also have another way of doing some of the same types of things with intentionality, where they might own a mini project or connect with their mentors in a different way, design objectives, support evaluation efforts, present their outcomes. And they might still be folding t-shirts, but there's with strategy and intentionality. the same number of hours, but and equally hardworking, but only one of those is going to leave them with a sense of professional identity and experience that will support them in their future career efforts.
So from the student perspective, like Lauren said, internships are where you first start to kind of form that professional identity. And it also gives you the opportunity to try new things safely. So before my internship, I worked on a research project with a professor, but I didn't have any practical health education experience yet. So this really gave me that opportunity to apply that classroom learning to the real world health education. And again, you get to test your interests and passions in that safe space. Um, from doing projects in class, I knew that I was interested in working in health education in some way, but I didn't know, one of the things at least I didn't know was what age group I wanted to work with. And doing this internship helped kind of navigate me towards working with college students, which I have found to love. Um, internships also help with professional connections. Making those professional connections is really important in finding a job after your internship or after you graduate. It's really cool to have a group of peers who know you and can speak to your skills. And also a few coworkers and graduate assistants while I was an intern in the office have gone on to work in other universities. So I reached out to them on multiple occasions for advice or just to see how they do things differently on their campus. So having those professional connections is really helpful in an internship, and it's something you really gain from it. You also hopefully gain some confidence in your abilities and what you have learned and where you hope to go next. You have time to determine those next steps. So, based off your internship, you either decide it's something you want to pursue further, maybe you want different public health experience in another setting, or maybe you decide that you want to try something completely different, but at least you know that and you can pivot from it.
So from the employer perspective, internships are often framed like the extra help. They're the extra capacity builders. But I really think that when they're done well, they can actually really support learning. When we're not only trying to focus on support for the goals that we're trying to achieve, but we're preparing the next professionals. We're shaping our future colleagues. And in this really great sense, I got to be a part of shaping Allie and then bringing her into my team full time. That doesn't always happen, but she got really lucky in that process to benefit her in that full time role. Um, but it is also an important way that I'm contributing to the growth of the field. Through real world experiences, it helps bring fresh perspective into my unit, keeps us connected into the student body because we're collecting that perspective and experiences as they are happening with students. Um, a lot of times I've also learned that the internships ask us really hard questions. Sometimes questions that we hadn't thought of because we have been in this role for some time. They see gaps that we've normalized. They push us to be innovative and new in different ways. They teach us the lingo. They tell us what's new and hip. And sometimes they can give us elements of innovation that we wouldn't have normally done within our field. And so having that internship experience that benefits both of us, I think, is a really, really valuable option. So how exactly could this work? I've developed a bit of a model for intentional internship experiences that I've used within my unit. And there are 5 basic backbones to this premise. The first is that your intentional internship will define a core set of projects and projects, not tasks. Tasks require me to tell you what to do, and I tell you all the parameters and expectations and what the outcome should look like. And all I'm asking you to do is take time. A core project might also have expectations and boundaries and settings and important skills, but it allows ownership of, and autonomy. It allows that intern to create within that core project. It might still be something we need done, or it might help us illuminate something new in our area. But the creative onus is on the student and not on me. The second is defining professional skills. So what might be some of the professional skills that I would want them to learn or that they would like to learn in their experience with us? So not just thinking about the task management, but what other skills can I provide? That might be public speaking. It might be professional communication. It might be working on coalition. It might be evaluation support. There's a ton of different things. Many of our interns have come in and said, I really want to work on my public speaking skills. So I will define core projects that pull on their ability to practice public speaking. Some of the tasks I might assign have a public speaking leaning to them. Others might want more experience with how do I build agendas and how do I build out reports and how do I use epidemiological data to help move a project forward. Well, I'm going to focus in on those pieces for that intern. The third is determining interaction with staff and partners. Our interns interact with the entire staff, all our full-time staff and our student staff, and we'll often bring them in on committees, joint project development work where it makes sense and it's appropriate to do so. We build that interaction then so they can kind of learn and shape their own learning with other people, and so that they can help build some networks in that space. So we don't want our interns just siloed to one room and only doing just one task and working with one person, but we want them to have the ability to practice working with lots of different professionals. Obviously where that makes sense to, where it's reasonable to. The fourth element is structured mentorship. So not just regular check-ins, how are your tasks, did you get them done, here's some more tasks, but structured conversations. What are you learning? What skills are you picking up on? How can I help you move those forward? What reflection are you doing? And building those conversations in, and I'll tell you a little bit more about how we've done that here in my unit. And then really pulling on reflection and evaluation. Are the interns having an experience that helps them grow professionally? I feel like if any of these are missing, we tend to have weaker outcomes with our interns. And maybe that's okay in some senses or some spaces. But for us, we really feel like that's our contribution back to the field at large, is to turn out students who've had a chance to actually experience what it's like to be a public health professional.
So this slide just shows what my internship looked operationally. So building routine was a large part of my internship for me. It was unique in the sense that it was 12 credit hours. So it was what I was doing the whole semester. I wasn't taking other classes. I was in the office full time. So I had to kind of get used to that, being in the office all the time. I had to set up a calendar, manage time. It sounds silly, but I also had to plan when and what I was going to eat. I hadn't really had to do that for myself in a while on a full-time schedule. And I also had to make sure to keep notes, to keep track of things in a journal. Like Lauren said, we had structured one-on-ones, so making sure I was keeping track of questions that popped up and just managing all of that myself. I also was a part of several projects going on during my internship. So my project, which is the picture on the screen, is a project that was historically done by interns in the office. So something that was really helpful for me was looking back at past reports of what other students had done with this particular event, this project. And then I had the freedom to do what I wanted to with it based off the past reports and conversations with supervisors. And that really helped me to have a foundation to start with for the project. But I was also part of other projects going on and other larger team events. So something I really liked in my classes was creating lesson plans and curriculums, presentations for health education. And a project did come up to do that for all of the new student conference students that would be coming in the summer after my internship. So I was part of a group that came up with that 20-minute presentation for alcohol education and bystander intervention. So that was something that I really enjoyed doing. It wasn't my project for my class, but it was a larger team project that I was part of that really helped me. And I was also able to see that project from start to finish, which was really cool. So I got that professional experience in starting to brainstorm a project, see it through different iterations and different phases, and then get to see it and actually present it to the students that summer. And I also, just to emphasize the whole point, is that I was not passively shadowing things during my internship. It was embedded intentional participation in the programming and all of the other things that were going on. So I could sit in any meetings that were going on with other campus partners. I was able to work, like Lauren said, with other students in the office, which was really cool. And then this is kind of a visual way of showing the intentional design that Lauren had for the internship, what I brought into it, and then some of the outcomes that I experienced. So again, we had the weekly one-on-one meetings. To this, I brought agendas, questions, kind of the check-in prompts and things that were going on. And from that, I gained professional confidence and the autonomy to do in the work that I was doing. I had the ability to do that on my own and gain that confidence. And like previously mentioned, I also had ownership over my project. So that helped me in getting experience in the full cycle experience of designing a project, a program over from start to finish, which gave me some job readiness skills in that, in designing outcomes and staffing the project with people in the office, seeing who was available, ordering supplies, all of that kind of stuff. And I was also included in committees for other projects we had going on, which I brought my own professional identity to, which then helped me network and gain confidence in those spaces.
And I really want to give Allie a shout out in this, which you might be thinking, well, what kind of projects can I really give an intern? And we really asked our intern to develop a presentation that would be provided at every new student conference, which there were 26 of them, for all 14,000 plus incoming freshmen, which is a really big, scary ask. But we asked our students to get together and develop what would that content look like, how would that be presented, and Allie had a part in both the brainstorm, the development of the actual lesson plan and script, the PowerPoint projection and graphics that were used, and even help train our presenters to be able to present that content in rooms. And if you aren't familiar, Texas A&M is a very, very large campus. So we did have 26 new student orientation presentations, 2 rooms of 500, 600, 700 students. So that is a really big opportunity. And I would say that played a good role in proving some job readiness experience. And so what I learned as a supervisor in that space is our students are very, very capable. If you can scaffold that well for them, they can do really, really cool things. Oh. So speaking of, what does that scaffolding maybe look like? So I want to kind of share what our kind of cycle looks like when we're working with our internships. I think a lot of times internships are not as strong experiences as they could be, not because of the workload, but because the mentorship cycle is not intentional and built on reflection. So early on in my career, I thought that just being available would be good enough, and that if they needed me, they could come ask for questions. But what I really learned over time is interns don't know what to ask. Students don't know what they don't know. And I needed to be prepared and set some scaffold and guardrails for them so that they could experience and try and be creative, but within some safety of the internship experience. That's the point. So what I do first is set expectations early and often and explicitly. So it's not task management. It is not just handing tasks off, but it's what does it look like to operate in our unit? What do I expect of communication? What are our standard timelines for how we operate when we do give project pieces? How do we break that into steps? How are we checking in? The expectation around we'll have a one-on-one, and here's what I would like for you to prepare for that one-on-one so I can help you manage the projects that you're working on. What does it mean to be professional? Professional dress, professional communication, professional presence. And we have lots of conversations around that. You might be attending your first committee meeting. What should that look like? And allowing them the space to try and experience, but set my expectations up early for what I want them to get out of that experience. The second piece is providing structured check-ins. So we do standing meetings once a week. Every full-time staff member and intern has that dedicated time with their supervisor. And the intent is not to get give me an overview of everything you work on. But the intent is to say, what are you learning? Where are you stuck? How can I help you? Not do it for you, but help you problem solve wherever you are stuck. That is the learning piece. That is the mentorship, the mentor piece. Sometimes that's managing a difficult conversation, how to navigate different personalities within an office space. Sometimes it's just, have you planned in your lunch? Are you getting enough sleep? This might be for many of our interns, it's the first time they've had something that's close to a full-time job. And so they might need a lot more support. And that's what this is for. They're not full-time employees, they're interns. And so we treat them like full-time employees, but we give them more structure. The third is giving real-time feedback. That is something that is important to me as a supervisor with my entire staff. But we will give real-time feedback, positive, constructive feedback. As we are experiencing things. If we're out of tabling events, I'm going to provide them some real-time feedback on this was great. Here's some other ways you can engage with students. Let's try setting these things up so you could get a better response from your students. What do you think might be going on? Why aren't students coming to the table? How could you do something to change that? And help in that navigation structure because they don't know what they don't know. Fourth, gradually increasing the autonomy. So if everything requires my check back and approval, they'll never build confidence for working on their own. So we start small. What are small things I can give you the autonomy to create, develop, and give, and then provide feedback and gradually increase that. I had a wonderful experience with that when I was an intern. It started with very structured time with staff members doing specific tasks. And as the time went on, I got more and more tasks that I did more and more autonomously. And so I mimic that within our internship structure. Starting with small things they feel comfortable with and moving toward big things. So the NSC, the New Student Conference presentation development was toward the end of Allie's. I would not have given that in the beginning. That would have been very scary. But we had the opportunity to work through several presentation development cycles before I said, okay, we got a big one. You think you're ready for it? And in fact, she was ready, did a fantastic job. And then finally building in that reflection and evaluation. So helping them connect what they did to what they're trying to do or to become. That might be questions like, how did you feel your presentation went? How did you feel like your presence was in the room? Did you feel like you had a good understanding of what the group dynamic was? If not, what do you think you might want to do to change that? Do you want to do some pilot practice? Shall we find some additional training, et cetera, et cetera? So really providing that reflection. One thing that I do want to encourage you, you might feel like you don't have anything to offer as a mentor. Maybe you've never been trained. I've never been trained, but your experience is really valuable. Instead of giving your experience in the form of tasks, give your experience in the form of learning so that they have the opportunity to learn through the same types of structures that you did. It's just in a safe, constructed way rather than throwing them into the fire, so to speak. So when you structure your interns, you help develop growth. And I think this goes far beyond just an experiential learning. It allows students to go from, I think I could do this work, to I really understand what this is going to look like, and I can contribute directly into the public health profession. That's through applied learning, through professional skills, through culture of feedback. But it also allows them to explore their career, to decide if this is the place they want to be, or if this is definitely not their interest area. helps them develop their own identity and build their own perspectives around public health, and building their own network. So these are lots of things that Ali shared that she attained through her internship experience. If nothing else, I think a great internship helps build commitment to the profession. And we know that public health can at times be a hard profession to be in, and it's a wide spanning profession. I have had a number of interns, probably 20 plus more interns over the course of my career. All of them have moved into a field related to public health or adjacent to public health, with the exception of two. And those two had the epiphany during our internship time that this just wasn't what they wanted. Both of those went into nursing. And so it was still a valuable experience for them. And I am very certain that things that they learned in their time with us are showing up in their nursing experiences. And if I went back and asked, I bet they would be able to pull some of that applied learning forward. They may just not have recognized it yet. So one of the most powerful tools you can start doing with interns or students or anyone that you're working with in a mentorship capacity is start setting goals. Start asking your students, what do you want to leave here being able to do? Not just file, fold t-shirts, or have a task, but what do you want to learn here? Most students who are looking for an internship experience or are looking for something specific, it's because they want skills. And they hope that you will help them get those skills. A lot of times they may not know what they want yet, and that's all right. But the question alone starts to shift their experience away from passive tasks to purposeful learning. So ask them, is it about developing programs? It is about presentations, confidence, public speaking skills, preparing for a certification or a graduate school program, or just exploring the field. Have them start to set SMART goals. I'm sure you're all familiar with SMART goals. Specific, measurable, achievable, relevant, and time bound. Have them start to align those goals with things that they're doing in their internship. So here's a couple of examples I pulled from some of our interns. They didn't come up with these. We had to do this together. But for example, by week 10, the intern will take a lead on planning one outreach or educational event. And that includes the logistics, the partner communication, the post-event reflection with the supervisor. That might look like a tabling experience, but they're doing all of it. That is a SMART goal and one that allows them to build autonomy growth. Or maybe it's by the end of the internship, they'll deliver 2 professional presentations, one to internal staff and one to a community audience. Or maybe it's about professional portfolio development, an updated resume, sample work products, professional interests. Maybe that's what they're hoping to get out of their experience. Setting a SMART goal will allow them to hold themselves accountable and create autonomy for achieving the learning experience that they would like. When we're thinking about growth and we're thinking about goal setting and structured projects, that's going to naturally lend itself into organizational benefits because you're increasing the capacity of your staff, you're bringing in fresh perspectives, you're developing their ability to move into the public health pipeline and contribute to other organizations and supports. And you're investing in your future workforce. In my case, I got a great ROI on my investment into Ali because she now works for me. But many other interns are working with departments that work with our unit. I'm investing in a colleague and partner I might work with. Or a colleague that works in a completely different industry. I'm investing in their growth and development, and they're doing the same for us. So I think this internship design has reciprocal benefits across the board, and it doesn't have to be perfect. It doesn't have to be a perfect system. Just a little bit more intentionality will help you gain that experiential benefit on the organizational side and on the student growth side. So as an example, what some of this might look like is if you thought about supervising an intern tomorrow, you could even start with one piece. What is one thing your intern could own? What is one professional skill that they might develop connected to that? And what is one way that you mentor them intentionally through that? And these are just a couple of examples. So maybe you say your intern is going to own a social media campaign, a set of reels or a set of carousel images to support a specific initiative. Maybe that's, I'll think of something right off the top of my head. Perhaps we want to put some critical information out about vaping on a smoke-free campus. Okay. So maybe you're asking your student to do that. Maybe that you set the stage. Here's what I would like to see, and here's when you need it. Here's what that looks like. The skill that they're building out of that is thinking about tailoring a message for a specific audience. And the way that you mentor that intentionally is by guiding them in SMART goal development, allowing them some autonomy to build and then check in with you to make sure they're on the right track, and connecting them in with their target population so they can make sure their social media makes sense. These are core public health skills. You're just synthesizing it and putting nice guardrails on it so that they can go and do it on their own. Another example that may be more administrative. So what if you are having them document process? Create the standard operational manual for this set of things that we do in our organization. We oftentimes ask our interns, take all the things that we're doing and write it down somewhere for us. Well, that is a professional skill in process analysis and continuous improvement. It requires critical thinking. It requires your intern to think, why do we do step A, B, and C? And how do I put that in a format someone else could read later? And you could guide them through that process, not by telling them what should happen next, but guide them through root cause analysis and decision-making frameworks. Why might we choose to answer the phone and do these set of steps instead of these other set of steps? You're mentoring intentionally versus giving them a text. And it's just a slight shift in how you organize your team. So I see a question, how do you go about generating your potential projects for students? We do that in a couple of different ways in my unit. One, I might pre-think about things that I would like to accomplish in that upcoming semester. I might also, I typically kind of have 3 columns. What are things that we have to get done and I need some additional capacity? That might be a project I give to an intern. What are things I'd like to do, don't have capacity for, but it's not a mission critical. It's this would be cool if we could get around to doing this. If that aligns with this, an intern's interests, I might go there. Or ask the intern, what do you want to learn or do? And see if I can back match something that might fit. And yes, Courtney, there will be a recording available so you can utilize this. I see also how to incorporate academia or industry partnerships in public health. As an internship supervisor, you could make some critical connections between your faculty partnerships or your industry partnerships to connect your interns potentially. So if you have a community coalition, for example, where you may be mapping multiple partnerships together, how could your intern play a role in that? And how could you allow your community partners to communicate with your intern in a way that might be a fruitful engagement? So for example, we have had internships work on our Be a Good Neighbor committee, which is a committee that is between the university and town and gown relationships. And that intern's purpose was to represent off-campus students in an off-campus carnival. So they had a portion, a small structured portion that they were responsible for in the development of this carnival. It was a big carnival, lots of fun carnival things, but also resource tables, education, with the purpose of exposing off-campus students to all the resources that are available to them. The intern was responsible for this one particular educational piece that is the responsibility of student life. So essentially that goes down to one table. But we connected her in with the coalition that was developing this large carnival. And her responsibility was to connect with that community and say, what things are most important that student life offers, and how do I make that present and available to our off-campus students at a table event? So she had to represent our department interests in this community coalition and in the development of this tabling. And what she got to do was, in all sense, a small thing. She had to come up with a table with a carnival style event, and we walked her through that process and helped her take resources and make it into education. But she also got to network. So she intentionally met most of the city managers and other folks who were part of that campaign. And I think she got a lot more out of the carnival experience than just creating her one table, because she got integrated into that partnership. So anywhere you can integrate is an amazing opportunity.
So we'll kind of wrap up slowly in the next couple slides, but we'll go over some lessons learned. So from the student perspective of being an intern, there were a lot of lessons and some things I would share with other students going through an internship. But the first is to be realistic with goals and objectives. Like Lauren said, I really had to be kind of coached through the goals and the objectives process, because I walked into the internship and I was like, I want to do my project and I want to pass my class and I want to graduate. So I had to think of some other things that were really skills that I wanted to get out of the internship. So I ended up having a goal about completing my project, but I broke it down into the objectives, like planning the activities, managing the staff that were facilitating it, setting the objectives and things like that. I also did have a goal about improving confidence in oral presentation skills, and that came through with some of the other projects that came up. But making sure that goals are something that you still are working towards something, but they're also realistic in the time constraints of the semester that you're completing the internship, is something that I had to kind of work on and do a couple iterations of some goals. Another piece of advice or a lesson learned would be to get to know the people that you work with. I think Lauren mentioned this, but we did have short introduction meetings with everybody in the office. So I met in my first week or two with all the full-time staff, all the student employees, the grad assistants, just to get to know each other and to make sure that we would be comfortable in a team working together. And I think this really helps with team cohesion and kind of fitting into the group. Try everything once is another lesson that I still try to live by. Trying new things can be scary, but if you're also viewing everything as a learning experience, it can make things more fulfilling if you're doing something new and scary. And going back to the folding t-shirts example that Lauren said earlier, it is just a task unless you look at why you're folding the t-shirts and how it's contributing to the team. So maybe it's creating a more streamlined process for the event that's happening later that day. It creates a more pleasant experience for students and staff. So you're still getting something out of it. It still has a purpose, even if it's not that exciting. And then lastly, being comfortable being uncomfortable. This goes again to seeing things as a learning experience, but you learn and you grow in that discomfort.
From the employer's perspective, some things I have learned along the way is put in the work before they arrive to set them up. Words today. Put in the work before they arrive to set them up for success. I spent a good amount of time thinking about how I would support interns, what my expectations were, and a lot of that was spending time thinking about making things explicit that were not explicit. There are a lot of pieces to working in a professional environment that we just learn, but we don't talk about it, and it's not necessarily written down anywhere. So I really spent time thinking about, what do I need to make explicit, from what my expectations are philosophically in the office, to how do I want them to communicate, what do I want their products to look like, not to the nitty gritty of I would like everything in a 12-point font, Calibri, to that level. But if I do have expectations on how they communicate, how I expect them to work through deadlines, how I expect them to dress and to interact, we need to make those explicit. because if not, they may not have ever experienced that. And so over the years, I've iterated on that and really tried to create structures and systems that help. I also created things like a planner board that had all of the onboarding type of questions that we would have for an intern. So things from like, when should I take lunch and how do I log into my computer? And what are the expectations when the university is closed versus open? Anything that might be questions that would come up for them. We've tried to collate that so that we have a resource for them. And that kind of ties into the don't assume they know. Surprisingly, there's a lot of things I've learned along the way that I thought would be natural to know that they just had never seen before. So I always take the premise, at least the first time, of not assuming they know something and giving them the benefit of the doubt, unless we've talked about it a few times. So for example, I've had a number of conversations with interns about appropriate attire. The first time is assuming that they may have never been told what business casual or business professional actually means. That's something that's important to our unit. And so I don't assume that they knew and made a conscious choice to dress inappropriately. Just like if their professional communication is lacking, I don't assume that they've ever needed to communicate with someone in that way, and that I might need to help coach that. I always approach it from the assumption that they'll make mistakes and need support. So I won't set them up with a mistake that is going to be a really big problem to fix. I always start off with places that they can make very safe mistakes in a comfortable environment. And that allows them to fail safely and learn. So I wouldn't put an intern in a place that if they were to make a mistake, it would be really detrimental to us or to them. Teach professionalism. I kind of mentioned that already, but teach them what professionalism should look like. What does that look like on screen? What does that look like in attire? What does that look like in presence, professional identity, brand acumen, all of the things that they might not be getting in a classroom setting. I want them to be able to experience it somewhere where if they get it wrong, it's not going to harm them. And then know how to pivot when it's not a great fit. Not every intern will be a great fit. And in my experience, I've had several that determined that this type of experience was not what they wanted. And in that case, I presented them with two options. I hear you. I see that it's not a great fit. We have two places to go. One, you could exit this internship now and use your time to find something that fits you better. Or let's talk about what we can do that meets us in the middle. So talking to students at a tailoring experience or giving presentations may not be the thing that works. And so I don't want to put them in that space because they won't have the best outcome. Are there other opportunities I can come up with in the office that might be a better fit for them in the interim that they're an intern that still allows me to build my capacity that I need? But maybe it's a completely different shift. So an example of that is I took one intern out of doing presentation, student connection types of experiences into administrative pieces. So instead, they helped look at evaluation data of organizing and creating systems for documents and a little bit more of like some of the administrative CHES responsibilities. I still tied it back to professional competencies. I just picked other ones for them and they felt more supported in that space. If you can pivot, try to pivot so that they at least get a good benefit out of it. So to kind of wrap this up, if you only remember three things out of all of this, I encourage you to remember that internships require intentional design, that mentorship matters more than the tasks, and that structure creates the confidence and workforce readiness. And I think I stole your thunder, Allie. I am so sorry. I just was like going
That's
and
okay.
going. Do you want to add anything as we wrap up?
Um, I have one more thing. Just that
Oh,
um Lauren kind of said this at the beginning, but the more intentional you are with the internship, the more it strengthens the future of the field and of public health. And an internship might be and probably is the first time a student is interacting with a real life public health situation. So you want that impression and that experience to be good, if at all possible. That's just the last thing I had.
And I want to call out Dr. Okay, hey girl, in the comments that encouraging students to have conversations with their preceptors about what their fit might be. And it might be a work plan or another connection between a course or curriculum credit that they need to identify so that they can ascertain if this internship experience is going to be the best fit. If you're unsure, you can always ask them upfront. What do you want to get out of this? Tell me what your work plan is. How does this connect to your academic preparation or your professional goal preparation? And then make a determination if your office or organization is the right fit for this intern. It's a two-way street, and it should always be a two-way street. If you're approaching it from the standpoint of you are my task worker, then be clear about that is what you're hoping for. But I think students would very much appreciate the opportunity to learn and grow with you as opposed to. So that wraps up our presentation, and happy to take any other questions if there are any. Otherwise, thank you so much for giving us a little bit of your time and letting us present this. Thanks again.
Thank you all so much for this presentation. Yeah, I'd like to open it up. I saw people were asking questions in the chat. So if you have any questions that maybe were not answered or you have any follow-up questions, please feel free to unmute yourself or add some more into the chat as well.
Hi, this is Diane Matson-Kaufman. I thank you for your presentation. I didn't really hear how you go about working with your university community or the community at large in generating projects, because I assume that's a really big and important step to being prepared in advance. You want to help the intern choose something meaningful, relevant, and timely. So how do you go about doing that?
Community partnerships are going to be based on a predetermined partnership that we might already have with the community. So we don't typically set up community-based internship partnerships without that already having been established with our unit. If an intern has a very specific desire to work with a community partner that we don't typically work with in our setting, we would likely encourage them to meet with that particular community partner. We might be able to spearhead a connection for them, but we wouldn't necessarily engage in a partnership unless that was someone that was already partnered with our unit so that we can establish that connection and growth mindset with our projects for them. So there are certain community partners we already work with on a regular basis that we might connect interns in. But for how our unit operates, would not necessarily work with a community partner we haven't ever worked with before, unless it relates to something our unit is responsible for achieving. If so, that would be some things I would maybe set up ahead of time. I would probably meet with that community partner, express some interest in working together, establish what that looks like before I would bring an intern in so that I could clearly establish the lane of the internship and the lane of the rest of our unit's responsibilities with that community partner. So very curated within our unit, but that may not be how every other organization operates.
Thank you.
Oops.
Hi, my name is Lisa Baker, and I have a question for you guys. I'd mentioned in the chat about including public health competencies in addition to the goals and objectives, which with some of our interns, we've done that really to certain departments, managers that are really good about that. Others aren't really as on board and haven't really handled interns as much before. So I was really actually just having this conversation with our director yesterday to make our internships a little bit more intentional, as you talked about, and trying to tailor them a little bit. So I guess our model right now is students apply, they come in with an idea or a project that they want to do, and then we try to match up and try to accommodate that. But I feel like we still struggle as well with with types of projects and capacity and things like that. All the things that you've mentioned. But I do really love. I just want to comment. I really do love the idea of having goals. I don't feel like we've always done that, but kind of thinking ahead on my part as an intern, just one of my responsibilities as a coordination of it. Having students come in with an idea of the skills they want to learn and maybe any goals, um, or even competencies that they might want to do, or do you feel that might be more once you get into the internship, once they're offered an internship, then
Yeah,
start doing that?
definitely. So from an operational standpoint, what we do is I will meet with an intern before we establish anything formal and talk about what our office does, how we kind of operate, and get a sense of what their interests are, if they have a particular type of project, if that would match anything we have going on. So kind of an intro meeting before we encourage them to move further. Um, we do have an application process, but we also had a pathway, a pre-developed pathway with the School of Public Health for the health education, previous health education majors. They were required to do an internship that was provided them 12 academic hours of credit. So we had a referral pathway set up where interns would be matched with our office, but I still met with them to see what are your goals? What do you want to get out of this? And really to help them understand that this is not an internship of filing and answering phones and chilling.
Right, right.
This is work and engagement, and we want that for you. So if that's not what you want, then we might want to go back to your internship supervisor or preceptor within the school of public health and talk about our unit may not be the right fit. If a student brings an idea, and we do typically have this with epidemiological and stat students who are really looking for like a subset of data that they can play with and move that into evaluation. And we don't always have access to that because we are a university and all of that kind of data collection is kind of controlled in a different way. And so I don't have data sets to give them. And so I do have to sit through and kind of walk through like, what are you trying to do? If it's really about data analysis, I'm not the best person, but maybe there's some other places you can go to. And sometimes they are intrigued by something else I talk about that we might be able to offer and they go a different direction. Or they say, you're right, this is not totally what I would like it to be. So I do understand how it can be kind of difficult to match those things. And sometimes it's just not a match. And that's okay. I usually incorporate a CHES competency assessment once they've already started. So I might have them do the CHES pre-assessment and have them self-report what do they feel of the CHES competencies, but you could also use the public health competencies or student affairs competencies. And I'll have them self-report. Where do they feel like they are really well prepared and where do they feel like they want more? And we'll go through those and say, okay, you've identified that financial prowess is not something that you have a lot of experience in. Is that something you might want to build into an internship somehow? And we go from there so that we're applying it to their professional competencies. But I usually do that after they've already connected with us.
Okay, that's a really good suggestion. I hadn't thought about the chess pre-assessment. We do some other, I guess, more like personality type stuff to see where students kind of fit in really well. Just one other quick question, and I'm just curious, as far as any kind of not all of our departments are on the same page about working with interns, but like project plans ready for a student. Is there anything that y'all use with your interns? It's kind of like a document that kind of lays all of this out that's consistent with all interns as far as the goals and objectives, those are laid out, what a project plan, or just kind of combines everything together.
Yeah, I don't know that we have something formalized, and that is because the vast majority of our interns are coming through that referral pipeline with the School of
Okay.
Public Health. And the School of Public Health provides a set of instructions and expectations for internships. So they kind of preset some of that information for us, and we just, it naturally flows into how we would operate. So those students they have to do a weekly journal, they have to set goals and objectives for their academic credit.
Okay.
So we
Right.
kind of used that sort of pipeline. Um, so I haven't had to set up a formal, like, this is what it looks like, because they're being prepared by their internship preceptor or supervisor, I guess they call it. They have someone assigned to them in school because they're getting academic credit for it. So we've
Right.
been able to do it through that mechanism.
Okay. I'm just trying to think through that, just to have some consistency with our students because they are coming from at our health district, coming from different backgrounds, different schools, online schools, but just set ourselves up and our interns and our managers know what to expect and how to handle because some of them are new to working with interns. So, but anyway, I appreciate the answers and thank y'all for the presentation. It's great.
Yes, of course. And for context, we typically only have one, maybe two internships at a time, or one or two interns at a time, and just for our unit. And so I'm not managing interns across a wide variety of internship managers either. So that contextually might change how you operate.
Okay, understandable. Thank you.
Yeah.
All right, thank you. I do want to be cognizant of time that it is 1:30. So just a reminder, if you need CHES MCHES credits, we will send that out to you. And of course, Dr. Dorsett and Allie listed their emails here if you need to contact them. If for some reason you can't reach them, feel free to reach out to T. Sophie. We'll help connect you all as well. Thank you all for the presentation. Thank you all for being here, and I hope you have a wonderful rest of your day, rest of your week, almost the end of the month. So take care.
Thanks, everyone.
Thank you.